Hi Mama, it's Katie here. It is time for our 37-week pregnancy update. So in these weekly videos, we talk about the development of baby, what is happening to our babies growing in our wombs, as well as what is Mama experiencing. And since we are in the final countdown towards birth, we are also going to talk about birth preparation. So let's talk about our babies first. So the baby is around 48 to 50 centimeters long and weighs around 2.8 to 3 kilograms. I had my last checkup in week 36 and baby was already at 2.9, so it's in the 66th percentile, slightly higher than this data that I'm sharing with you here. So if we were to compare our babies to a fruit or vegetable, it would be compared to a bunch of kale, which I don't have today. But what is happening to our kale babies? The organs are finally fully developed. This is so exciting. So the lungs were the last organ to keep developing, and now in week 37, this organ is also ready. So baby, essentially, if baby was born now, they would be called an early term baby. And they can survive on their own without any additional help from the doctors or from any medical perspective. The baby's brain is still developing nevertheless, so a full-term baby is at 40 weeks, so ideally they would still sit there a bit longer, because with every day and every week they are even better prepared to join us in this world. And there's a lot of brain development that is constantly happening also towards the end of pregnancy in these final weeks, as well as the strengthening of the immune system is taking place. So whatever antibodies you have in your body are being passed on to your baby through the placenta, so this is also super, super important. The fat continues to build up under baby's skin, so they're getting plumper and plumper with every day and every week, and the baby is practicing sucking and grabbing and pulling and swallowing. So these are the skills that are called key survival skills for a newborn. And I could see on the recent ultrasound that my baby was indeed sucking on the hand and moving a lot. So that is when it comes to baby. Almost ready to come out, but ideally they'll stay in a bit longer. What is happening to us mamas? You will be experiencing more Braxton Hicks, and they might be more often and stronger. The pelvic pressure is getting stronger as well as the baby is moving downwards in the pelvis. You might see that your belly is starting to drop downwards as well. And sometimes you might experience something called lightning. So it's this kind of sudden pain in the pelvic area. It's also called engagement. So it's just a good sign that everything is correct and your body is preparing for birth. But because baby is lower and baby is gaining more and more weight with every day and week, you could also be experiencing more pain in your hips and in your lower back. What else is normal at this stage of pregnancy is the swelling of the hands. So today I have no watch and I don't think I'll put it on anymore because my hands, my fingers and my wrists continue to swell up. So I'm not comfortable anymore keeping a watch on because it doesn't stay. I can't click it correctly without having it dig into my skin. So the watch is gone. Let's see when it comes back. When it comes to swelling of the feet and legs, you can use compression stockings. These are still highly recommended to wear until the very end, even though it's getting harder and harder to put on. You might also be feeling more fatigued, so more tired again, something similar potentially to what you were experiencing in the first trimester. And this is also normal, so rest when you can, rest as much as possible, get a good night's sleep with using pregnancy pillows. And if you can allow yourself to have a nap during the day, definitely go for that nap as well. And despite you feeling more tired and having less energy, on the other hand, you might feel a sudden burst of energy connected to the nesting feeling. So you might want to tidy your home, prepare for baby, set everything up, make it absolutely perfect to welcome the new joiner. And one more thing that you might be feeling is heartburn and indigestion. So this is something that I've been experiencing the last week quite a lot actually. The indigestion is really kicking in. So it is harder and harder to digest and get rid of the unnecessary food in the toilet. So it is recommended to have small, well-balanced meals, keep them light, and drink a lot of water. That will help. And that also helps with the heartburn. So for the first time in my 2 pregnancies, I experienced a pretty bad heartburn a few nights ago. It was at night, so that was not pleasant at all. All right, what else do we need to think about, and what else should we prepare? So potentially a hospital bag with your necessities, with some extra things for the baby. Review your birth plan with your provider, your doctor, the hospital that you're giving birth at, the birth house, so everybody is aware of your wishes, and potentially option A, B, C, what your preferences are. I have made a separate video about a birth plan, what it is, to kind of explain the options that you might be considering, and that then you will put into this birth plan. And I've linked a birth plan below, which you can download and use and fill out, and then provide to your provider. So like we said, prioritize rest, prioritize healthy, well-balanced meals throughout the day, and drinking a lot of fluids and hydration. And the last thing that I wanted to mention is to also practice relaxation, meditation, and breathing techniques, because these techniques is what can help you to manage the contractions when labor starts, and if you start stressing and becoming distressed in labor, to go back to a certain way of breathing, involve your partner in this as well, in this breathing process, have them count for you while you do focus on the breath itself. This is one of the techniques that can help you in labor. And I have also made a separate video about breathing, how to breathe, what some options could be that might help you. So have a look at that one as well. It's in the description box below. And if you haven't done it yet, you could also look into hypnobirthing. The courses sometimes are longer, but I do have another video where I talk to a hypnobirthing expert, where we share some essentials about hypnobirthing, what it is, and how it can help in the birth process. So have a look at that one as well, if you feel time constrained. So that is it from me. Good luck. I keep my fingers crossed for you that baby still stays a few more days, if not a few more weeks, that you feel well, that you feel well prepared, and that you still join me in the next days and weeks for some final touches on our side when it comes to training in pregnancy and preparing for birth. Thank you for joining today, and see you soon. Bye.